Hi, good morning. Today we will discuss about the COVID-19. This is a corona disease 2019 or the COVID-19 as we call it. This is a respiratory illness that can spread from person to person. So ibig sabihin ng person to person, it 1 meter or to 1.5 meter apart or 6 feet apart from a person. So the virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. How COVID-19 spreads. So current understanding about how the virus that causes coronavirus 2019 spreads is largely based on what is known about similar coronaviruses. So ito yung what are those similar coronaviruses? Ito nagsimula doon sa SARS, sa MERS. So same family siya. So kapag sinabi natin person to person spread, this is between people who are in close contact with one another within 6 feet or 1 meter apart. And then via respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly with lung infection. So, kapag nag-cough out, nag-sneeze, malapit ka lang contact dun sa tao. So, possibly yung droplet, mai-inhale mo siya hanggang pumunta dun sa iyo, maapektuhan yung respiratory system mo kung siya ay exposed dun sa coronavirus. Again, it should be 1 meter or 6 feet apart. Spread from contact with infected surfaces or objects is also the secondary transmission. First, the primary transmission is yung person to person, 1 meter, 6 feet or 6 feet apart. And then the secondary transmission will be the infected surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Kasi nga, sinabi natin yung primary will be the person-to-person contact and this will be the secondary. Kapag, umubo or humaching yung affected person, then yung droplet, kasi yung gravity mabigat, yung coronavirus, pupunta siya dun sa surfaces. And then, kapag nahawakan mo or nahawakan ng ibang tao, immediately yung surface, unknowingly, and then walang precaution na ginawa, nagkamot ng mata, makati, or tayo pa naman we're fond of touching our nose and even our mouth, the face, without even doing the hand washing. So yan yung secondary transmission. When the spread happens, people are thought to be most contagious when they are most symptomatic. Ibig sabihin ng symptomatic, ito ay kung meron ka ng symptoms, madali kang makakahawa. So, ibig sabihin nun, ano ba yung mga symptoms? Fever, cough, shortness of breath or difficulty of breathing, may lagnat ka, may ubo ka, nahihirapang huminga, sometimes it will be accompanied by sweating or sore throat. So, yan yung mga symptoms. So, when you are symptomatic, dyan yung sinasabi na contagious ka. Mas madali kang makakahawa ng iba. Some spread might be possible before people show symptoms. There have been reports of this with this new coronavirus, but this is not thought to be the main way the virus spreads. So, sinabi din nila from the study na even wala ka pa rin symptoms or asymptomatic, you can also be a carrier kasi na-expose ka doon sa bansa na maraming affected ng coronavirus or ng COVID, and then bumalik ka na halimbawa dito sa Saudi or kahit saan with your family, wala or nagkakontak ka doon tapos bumalik ka na, so wala ka pang symptoms, pero incubation period niya is within 2 to 14 days from the exposure, from the time of exposure. So even wala ka pang nafe-feel or wala ka pang symptoms, you might be also considered as a carrier. Okay, pero again, hindi ito yung thought to be the main way the virus spreads. Ang main ay yung kung you will be considered contagious if you really have the symptoms. Pero sa study nga, pwedeng carrier ka na din. Okay? Once na-expose ka dun sa bansa, once na-expose ka dun sa tao na affected, or sa animals, or dun sa mismo may sakit na. And then, there are still more to be learned kasi marami pang studies na ginagawa hanggang ngayon ang mga researchers about the transmissibility, severity, and other features ng COVID-19. Hanggang ngayon, pinag-aaralan nila kung gaano katagal yung coronavirus sa COVID-19 sa surfaces. Kasi doon sa SARS and MERS, there are 22 studies na nagawa na it takes 4 to 9 days na nandun pa rin yung SARS and MERS sa mga surfaces. But then sa COVID-19, wala pang specific na data na gaano katagal ang coronavirus sa COVID-19 sa mga surfaces. May nagsasabi na it will just be for a short time na nandun sa surfaces, so mawawala agad, pero hindi pa confirmed. Even sa temperature, may nagsasabi na namamatay agad yung coronavirus from the COVID-19 kapag sobrang init na ng paligid, pero there's no such studies yet and it's not yet confirmed. Kahit pinag-aaralan din nila ngayon kung bakit mas marami ang population ng matatanda na naaapektuhan ng COVID-19. Hindi tulad ng SARS and MERS-CoV na distributed. Marami ang bata, marami ang infants, marami hanggang sa pagtanda. Pero sa COVID-19, very less yung mga bata na naaapektuhan. So, more on the adults. Okay? So, yan ang COVID-19. So, pinag-aaralan nila yon. Why? Bakit mas marami ang mga matatanda? So, the symptoms of COVID-19, patients with COVID-19 have reportedly had mild to severe respiratory illnesses. The symptoms will be a fever, cough, shortness of breath, or difficulty of breathing, and pwede natin isama na rin yung sore throat. And then the symptoms may appear 2 to 14 days after exposure. So kaya nga, laging ina-advise natin sa mga galing bakasyon, kung ikaw ay kasama dun sa mga bansa na maraming cases or nagkaroon ka ng contact sa person who's affected with COVID or na-expose ka dun sa mga sinasabi nga dito sa MOH dito sa Saudi, kung expose ka rin sa camels or anything, so yun ay camels or camel product or sa tao, so sinasabi nila na kailangan mo do self-confinement or self-isolation for 14 days until the time the symptoms will appear. So after 14 days at wala naman, so you can be free and return for work. Pero just in case within that 14 days may nag-appear na mga symptoms, you can immediately inform your employer or somebody from the healthcare para mabigyan ka naman ng support. Okay? You can isolate yourself. You can have your treatment at home kung hindi gumagrabe. Pero as long as nagkaroon ng mga complications, pumunta na doon sa nahirapan kang huminga, you really need to go to the hospital and you will be prioritized para doon ka ma-confine. Pero sometimes ina-advise din nila na for home isolation and for tracking purposes, ina-advise na nila na sa hospital. But be sure na kung may home isolation ka, kailangan hindi mo i-expose ang family mo. Be responsible to yourself and be responsible to your family as well. You need to have your mask, your N95 mask kung ikaw ay affected na ng sakit. And then, your family should also be wearing. Okay, so, and that means kung mag-aalaga ka nung may sakit at naka-home isolation, so dapat naka-N95 ka na din. But then, kasi dahil rampant at marami ang naapektuhan. So, kung naka-home isolation ka, so yun, that means kung sino man yung mag-aalaga sa'yo, so dapat N95 na rin siya. Kung sa hospital ka, kapag naka-isolate ka na doon, yung nurse na mag-aalaga sa'yo will be wearing the N95 at the same time kung sino man yung mga papasok doon sa isolation room. Ang mga tao na nasa labas or sa public areas, kung ikaw ay wala ng sakit, kung walang sakit, again, hindi ka dapat mag-protective mask. Ang kailangang magsuot ng protective mask ay yung may mga sakit. Okay? Yung may mga symptoms. Hindi kailangan ikaw na malakas at walang sakit. Okay? Prevention and treatment. So, avoid close contact with people who are sick. So, kung mayroon ka ng mga symptoms, kailangan be sure na ikaw mismo may sakit. You isolate yourself. And then, ikaw na may sakit, mag-mask. And at the same time, yun naman na nag-aalaga sa'yo will also be wearing a mask. So, avoid touching your eyes, nose, and mouth. So, ibig sabihin nito, malimit kasi tayo na humahawak or nagtatouch dun sa mga public surfaces o yung frequently touched surfaces. So, immediately, ang tendency natin will be ito yung mata, hawakan, yung ilong, and then yung bibig, your face. So, isa yon sa makakapag-transmit. So, be sure that before you touch your face, your eyes, your nose, and mouth, you do your hand washing. Okay? And then, stay home when you are sick. Hindi mo kailangan pumunta sa hospital. Hindi mo kailangan pumunta for work if you are sick. Pero that doesn't mean na i-abuse natin yon. If you have colds or cough na hindi naman ganun kagrabe, you still need to go for work, mag-mask ka lang. Okay? And then, kung of course, ikaw na yung makikiramdam sa sarili mo kung magrabe yung ubo mo or yung sipon mo, of course, kailangan mo nang mag-apply for a sick leave and do your self-isolation kasi hindi natin alam baka kung ano na yan or it will just be a normal flu later on. And then, you need to stay home when you're sick, sinabi ko nga yan kanina, and then cover your cough or sneeze with tissue, then throw the tissue in your trash. Okay? So, cover your cough. Right, na dun pa lang sa desk nyo, kung ikaw ay nasa post mo, sa trabaho mo, meron ka ng tissue dun nakatabi. Wala naman tayong ubo minsan, pero ang tendency natin, umubo pa rin. Pero it's not yung talagang ubo. So, tissue na tatakpan nyo rin yung ubo nyo ng tissue o kung biglang humatching may tissue. If tissue will not be available, be sure that you will use your ganito yung sleeve or the elbow. Itong ganito sa may elbow natin. ubo, and then sneeze. Okay? Yun ay kung wala available na tissue. Pero kung aksidente na hindi nyo naman na pigilan yung pagbahin o pag-sneeze, nagamit nyo yung kamay, that's the time you can immediately do your hand washing, and then or dun sa post mo meron kang hand sanitizer, so you can just sanitize your hands. And then also you need to be responsible with your post. Huwag mo nang hintayin yung cleaner mo na mag-disinfect ng iyong surfaces. That is your own private place. Ikaw lang naman yung humahawak dyan. So mas busy yung ating cleaner sa labas, yung mga public areas, public surfaces na dapat niyang i-disinfect. You yourself should be responsible in disinfecting your own post, your desk, your chair, your armchair, yung frequently touched na phone, yung handheld phone, lahat. I-disinfect mo siya with Clorox, diluted Clorox with water. Meron yan sa manufacturer kung ano nakalagay, sometimes 10 ml to 1 liter of water. So sundin nyo kung ano yung nakalagay sa manufacturer's instruction dun sa bote niya. Okay? But not necessarily na kailangan pure yung Clorox na ipapahid mo. So hindi rin naman maganda yan kasi toxic. So it should be diluted with water, or sometimes, or you can also have the Lysol. May dilution din yan. CDC or the Center for Disease Control and Prevention does not recommend that people who are well wear mask, okay, or face mask to protect themselves. So hindi siya dapat magsuot ng face mask. Ang magsusuot lang ng face mask ay yung may nararamdaman na symptoms. But we, na mga walang sakit, so kailangan hindi tayo magmamask. Yun lang, mga healthcare workers na nagtatrabaho sa hospital, kailangan nilang mag-wear ng protective mask, and also those people who are taking care of someone in close settings like naka-home isolate or nasa healthcare facility. Yes, so again, ang mga walang sakit, it's not necessary na magsusuot ng protective mask. Mas kailangan ng mga may sakit ang magsuot ng protective mask. Also, those who are working in the hospital or the healthcare workers should be the one wearing the protective mask kasi sila yung may contact sa pasyente oras-oras, every minute. And also, those people who are taking care of someone in close settings like the home settings and healthcare facilities, so sila yung magsusuot ng protective mask. Hindi kailangan magsuot, again, ang mga walang sakit ng protective mask. Nagkakaubusan ng protective mask. Mas i-prioritize natin yung talagang dapat gumamit. Kung wala tayong mga sakit and tayo ang gagamit, paano na yung mga magkakasakit pa na nahihirapan ng kumuha ng mask? Okay? So as much as possible, kung walang sakit, don't use a protective mask. Okay? And then, be sure to wash your hands with soap and water for at least 40 to 60 seconds kung hand washing facility yung gagamitin nyo, yung soap and water. Kung hand sanitizer naman, it will be 20 to 30 seconds. So kapag hand washing facility, it will be like this. So wet your hands with water and then soap. Pagkatapos nun, distribute yung soap sa palm and then dorsal, also like this, and then palm to palm interlaced, and then your like this, para yung mga creases and yung inyong mga fingertips malinis din. After that, your thumb. Tapos fingertips, and rinse with water. Tapos dry tissue to dry your hands, and then huwag itatapon yung tissue na pinag-dry ng inyong kamay. Yun din ang gagamitin nyo para pampatay ng faucet. Okay. Same thing goes with your hand sanitizer. Ganon din yung procedure. Medyo mabilis lang kasi it will take you 20 to 30 seconds. Wash your hands. Bago hawakan yung mata, ilong, or bibig, or yung mukha, ang mag-wash ng hands. Refrain from handshaking. Okay? Kung merong tao na nauna na iabot yung kanyang kamay at nasa corporate world kayo, so you can tell with respect na I'm sorry kasi it's not allowed for us to do the handshake, pero kung hindi talaga maiwasan, you can do handshaking, pero right after you can wash your hands. Be sure na nakatalikod na naman siya or hindi na niya makikita na mag-hand sanitize ka for respect. But be sure you will not touch your face also, your eyes, your nose, and mouth after handshaking. Wash your hands first. Germs are all over our places. Nakakalat yan kahit saan ka humawak, andyan yan, yung droplets. So, alam niyo ba na yung mobile natin is one of the dirtiest gadget. Kasi when was the last time you clean your mobile? Okay? Minsan kahit nga yung ating glass, yung eyeglass, basta na lang natin susuot, minsan kung saan na natin ipinapatong. So, make it a habit na nililinis niyo sila every day. For a study, dun sa mga studies, ang mobile dapat daw nililinis at least 2 times a day. Or as frequent as possible kasi andito yung COVID-19. Even yung eyeglasses natin, bago nyo isuot, be sure that you are cleaning it, disinfecting it. Okay, kahit ikaw lang yung nagsusuot. Kasi ipinapatong mo yan sa mga surfaces, hindi mo alam kung ano yung mga nandun. Okay? Be sure also na hindi nyo nadadalhin yung mobile nyo sa CR or sa toilet. Ang dami-daming nagpa-practice ng ganyan. And then right away, after makagamit ng CR, ilalagay sa pocket, daladala sa bahay, paglalaroan ng anak. Okay? So it's not healthy. So be sure na lagi nyong lilinisin ang mobile, eyeglasses, yung kayo yung mismong nagsusuot o gumagamit. Okay? Cover your mouth whenever you cough, whenever you sneeze, again, with tissue or with your elbow or your sleeve or your if you happen to accidentally cover with your bare hands, be sure that you will do hand washing. Okay? Be serious in your hand washing. Okay, about the treatment, again, there's no treatment in COVID-19. It will just be a supportive care to help relieving the symptoms. Okay? So kung mag-aggravate o kung maging severe siya and turn into complications, yun yung mga gagamutin kapag nasa hospital ka. Okay? It's just kung may fever, so gagamutin nila. Kung meron kang ubo, gagamutin nila, pero naka-isolate ka na. Kung nag-a-aggravate, gumagrabe, yun yung gagamutin nila. Kung may pneumonia ka na, may mga sometimes nagkakaroon na ng problema sa mga organs mo. And then, kung people who think they may have been exposed to COVID-19, or kung ikaw ay naisip mo or na-check mo yung sarili mo na parang na expose ka sa may COVID-19, be sure to contact your healthcare provider immediately and tell na na-exposed ka para sa advice na ibibigay sa'yo. Can do their part to help us respond to this emerging public health threat. Do your preventive measure. Like what? First, hand washing. Don't touch any surfaces, public surfaces. After touching, be sure you do the hand washing also. And before touching your eyes, nose, and mouth or face, do hand washing. Cover your cough, cover your sneeze, okay, with tissue or with your sleeve or elbow when coughing and sneezing. Okay? Very simple prevention na nakakalimutan natin, kaya ang bilis-bilis mag-transmit ng COVID. If we only practice those preventions, hindi tayo mahahawakan. Okay? Also, maraming gumagaling sa COVID-19. Marami lang ang nahahawahan kasi hindi pinapractice. Okay? Kaya hindi pinapractice ang prevention, kaya ang bilis-bilis dumami ng statistics. Pero marami ang gumagaling. Okay? And if you will see yung mga namamatay, hindi yun namatay dahil sa COVID, dahil sa coronavirus. Namatay sila dahil sa complications. Okay? Hindi agad nagpagamot or hindi agad nagpunta sa health facility. Nag-self-medicate. Pero hindi nila alam na coronavirus na pala yun. Hanggang sa bumabi, nagkaroon ng complications. And laging iisipin na ang coronavirus, ang COVID-19, ang ini-infect niya ay ang respiratory system. So, later, kapag bumabi pa yan, magkakaroon na ng mga maapektuhan ng ibang organs. It will result to multiple organ failure. And dun, nahahantog, kaya namamatay. Pero very less ang namamatay. Mas marami ang gumagaling. Okay? So kaya nga, gawin lang yung prevention, hindi tataas yung statistics ng COVID. A very simple prevention measures. Basic prevention. So now, if you are affected with novel coronavirus 2019, and just recently returned travelers from China or those affected countries, you need from the last 14 days and feel sick with fever, cough, or difficulty of breathing, you should seek medical advice. Call ahead before you go to a doctor's office or emergency room and tell them your recent travel and your symptoms. Kasi you will be prioritized. Hindi mo kailangang maghintay on queue doon sa waiting area ng pasyente. Kung may mga symptoms ka na ganyan, you will immediately be seen by the doctor. Avoid contact with others. Hindi mo kailangang kapag-usap or contact with others. Mag-mask ka na. Okay? And then do not travel while sick. Huwag kang maging mobile. Don't roam around. Okay? And cover your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. Wash your hands with soap and water immediately after coughing, sneezing, or blowing your nose. If soap and water are not readily available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Always wash your hands with soap and water if hands are visibly dirty or soaked. Don't settle for your hand sanitizer. Okay? Also, when you are in close contacts, information for close contacts of a person confirmed to have or being evaluated for 2019 COVID infection, steps to help prevent the spread of COVID-19 if you are sick. If you are sick with COVID-19, you need to follow the steps. So first, you need to stay home except to get medical care. You should restrict activities outside your home except for getting medical care. Okay, so you need to isolate yourself if you got a contact with COVID-19 suspect. Isolate yourself also for 14 days and observe for the signs and symptoms. Separate yourself from other people in your home as much as possible. Stay in a specific room. Get away from people in your house. Separate yourself to your children. Basically, self-isolation. Get ready with your medicines inside. Your personal belongings will be there para kahit anong oras meron ka dun sa loob ng iyong kwarto, yung basic needs. And then call ahead before visiting a doctor. Kasi kung nakita mo na may mga symptoms ka na lumalabas, so at least you need to call ahead your doctor. Sabihin mo na mag-visit ka. Get an appointment para pagdating mo sa hospital, you will be prioritized. Always wear a face mask kung sa tingin mo meron ka ng symptoms or you are sharing a room, kung ikaw ay may sakit, so wear your face mask. Inside the office, kung ikaw ay may ubot-sipon, wear your face mask. Okay? It's not necessary the N95 kung nasa office ka. So protective mask or the surgical mask will be enough kung may ubot-sipon. And kung may sakit na nga, protective mask pa rin. Right after na ma-confirm ka and may isolation sa hospital ka na, that's the time you will be given your N95. Also, yung mga nurses na nagte-take care ng COVID-19, confirmed COVID-19 pasyente sa isolation, sila naka-N95 na. Okay? Also cover again and again, lagi natin sinasabi, when you cough, when you sneeze, cover it with tissue, cover with your sleeve or your elbow. Okay? And then right after na baka accidentally ginamit niyo yung bare hands niyo sa pagtakip ng bibig, right after, do your hand washing. Okay, we have two kinds of hand washing, by using the soap and the water and your hand sanitizer. Clean your hands always. Okay? Avoid sharing personal household items. You should not share dishes, drinking glasses, cups, eating utensils, towels, or beddings with other people in your home. After using these items, they should be washed thoroughly with soap and water. Okay, then monitor your symptoms as you isolate yourself. Monitor your symptoms. Observe for yourself. Observe those symptoms na kung anong lalabas na symptoms like fever, cough, difficulty of breathing. This is the main symptoms ng COVID. So kung meron na kayo niyan, do your self-monitoring. Call immediately your healthcare provider or your doctor para sa advice. And then regarding the discontinuation of home isolation, ito yung mga supporting days sa incubation period. Kung wala kayong nakita, then may advice na ang doctor na you can free yourself from isolation, so it's okay, or home isolation, then you can return for work. But then if you are still isolated in the hospital, there will be several tests again. I think 2 tests dito sa Saudi Arabia, 2 negative tests para mag-come up na ikaw ay free na sa COVID. So may proseso yan, hindi ka agad-agad makakalabas sa hospital. They need to be sure na ikaw ay free dun sa virus. Okay? And that's it. I think this is the basic information about the COVID. So I hope na makapag-inform tayo ng mas malinaw na kaalaman laman sa publiko. Again, we should know the basic prevention. If we only practice it, hindi imposible na bumaba ang statistics ng COVID-19. Kaya marami ang statistics nito, and it's worldwide kasi neglected yung basic prevention, which are hand washing, touching of eyes, nose, and mouth, touching of surfaces, those unnecessary surfaces, and then covering your cough, your sneeze. Nakakalimutan to yung mga 4 basic prevention. Okay? Let's just apply the standard precautions. So, hindi tataas ang statistics ng COVID kung ina-apply lang natin to. So, sa lahat ng tao, sa lahat ng Pinoy, sa lahat ng OFWs, just remember the basic preventions and you will be free from COVID-19 and such other diseases. So thank you so much, and be safe always. Consult a doctor if you feel the symptoms. Always bear in mind that our health is wealth, and the basic prevention will still be important ways para malabanan tong COVID-19. Okay? Thank you so much, and be safe always.